to open home health cases when they are on the physician's order with a qualifying service. So it lets home health agencies use their skilled staff more flexibly. For us, it does a couple of things. It elevates our status one more level. At this point, if this bill passes, we will be able to do everything that any of the other skilled services are doing in the home, so it provides support for our argument to later become a qualifying service. Second of all, allowing home health agencies to better use occupational therapists and to use them to do the initial assessment. It can quicken the pace with which they can open new cases, and it allows them to hire occupational therapists when they might have hired another profession because we couldn't open the cases under current law. So that's a big reason why we want to move this forward. A couple of the particular talking points related to this is that it's not an expansion of Medicare benefits or services or eligibility, so there should be no significant cost to this whatsoever. And we expect it to be budget neutral or very close to budget neutral. The National Association of Home Care and Hospice, the largest home health agency, home health association in the country, is actively supporting this bill, as is the American Physical Therapy Association sent us a letter and sent a letter to Congressman Lewis supporting us on this because they see it as a way to improve access for patients and to make sure that the most appropriate skilled service is the one who's doing the assessment. If a physical therapist is going to be opening the case and doing most of the service, it makes sense that they do the initial assessment. If an occupational therapist is going to be providing most of the services the patient needs, it just makes clinical sense that the occupational therapist be the one to do the initial basis assessment. Sometimes there's concerns over scope of practice or whether it affects physicians or nurses. Physicians and nurses are two sort of powerful groups up here on Capitol Hill in terms of their associations and their membership and their numbers. This bill doesn't affect any other groups besides occupational therapy, physical therapy, and speech therapy. It's specifically written so that nursing, if a case is receiving skilled nursing service, that nurse is always the lead on the case. That's true regardless of any of the rehabilitation groups that are in there. That's part of Medicare law. And this does not change that at all. Sometimes there's confusion about whether this means that an occupational therapist would be able to provide services without a physician's referral. That's another issue that gets complicated up here. You might get that question. It doesn't affect that. It still requires a physician's referral in order to have an occupational therapist open the case and start the assessment. There's something in the back of the room that you're going to have. And it's when you pick up your packets, also be sure to pick up one of these sheets of paper for your packets. It's a Dear Colleague letter from Congressman John Lewis addressed to all of the members that you're going to be talking to today, addressed to his congressional colleagues, asking them to co-sponsor the legislation. That's why I chose to do this one last, for a couple of reasons. One is that we have a specific Dear Colleague letter. It's the perfect way for you to present that to them and ask them at that time for them to co-sponsor the legislation. There is no known opposition to this bill. There's no group out there that's fighting against it. We have several groups that are supporting it, and the Dear Colleague letter can really be helpful. John Lewis is a member of the Ways and Means Committee. He's well respected, and we're hoping to be able to really get co-sponsors through your work today. It's also the most important piece of legislation that we're talking about today directly for OT. Mental health parity is great, it's really important. We've been supporting that for a long time, but there's a big constellation of groups out there that are supporting mental health parity. We need to do our part, but there are others fighting that fight. Healthcare reform, we need to have a voice in it, but that is a big game as well. This piece of legislation, there's no one out there working on it directly pushing it as much as AOTA is, and occupational therapists and occupational therapy assistants. So we need your help to get that done. So when you read over this bill, make it the last thing that you ask for them, and take your time with it. Find a few talking points from the one page that you have, and use the Dear Colleague letter as your way to really close the end of your meeting and say, here's a letter from your colleague. Please sign on to this as a constituent. That would be very helpful for us in building co-sponsorship and being able to move the legislation. Are there any questions about the home health bill?
I have one, Tim. ASHA is silent. We have, TA support. Is ASHA just silent, or?
So far, we talked to them. They were very supportive, saying that they certainly don't have any problem with it, and they're sort of in the process of trying trying to get approval to support it. One of the things we're doing at APTA actually gave us a direct independent letter. We requested it, and they were able to do that for us. Other things we're doing, we're part of the Consortium for Citizens with Disabilities. It's a broad healthcare disability rights coalition of healthcare consumers and providers. And their health task force has agreed to circulate a letter in support of this as well. And that can be a way to get other associations on board so that they don't have to stand alone and say, yes, we're supporting this and stand out in a crowd. Instead, they can just sign on a coalition letter with a group of other individuals. So we're expected to do that so that we can.
Thank you for being here today. I know you guys come from all over the country, and it's exciting time to be in Washington. I'm sure you hear a lot about the financial news.
Yeah.
There's a big bill moving through the process of the right fashion, so a lot of Congress is focused on that this week. And then they're focused on the elections. This is the last week supposed to be here, and then they're going to adjourn the campaign for 6 weeks. So keep their job. That tends to be the thing that drives people around here. How many people, raise your hand, it's the first time doing this kind of business in DC? So most of you guys. This is really great that you're here. Most congressmen and senators don't get back into town until Tuesday afternoon, Tuesday evening. So it's most likely when you're meeting today, you'll be meeting with staff members. And many of them will be very young, in their mid-late 20s, sometimes in their 30s, but really not much older than that. But very bright people, and some of them are from their districts. Some they have just gotten on with the member staff, who's some expertise that they have. But generally, most staff people that you'll be meeting with handle 5 or 6 different issues. So healthcare is just one of them. They're also handling Social Security or the environment or law enforcement, uniform policy or taxes. So you can assume pretty much a good level of ignorance about the issues you're going to be discussing. So the first thing I would suggest to you is to talk a little bit about your profession. What it is you do, how you treat patients, and why the legislation you're talking about will enable you to do a better job treating the patients. Secondly, if you're from their district or even from their state, it's important to mention that, because if you're a constituent, you're in fact their boss, and they're very sensitive to that, and they'll feel more inclined to help you if you're from the hometown, or even if you have a connection there, you know, your parents live there, or you went to school in that district. I mean, use anything you can to make a connection with why are you in their office, and why are they spending time with you. And the more you have a hometown connection, the better off they'll feel. The second issue, obviously, are the policy arguments that you're presenting. Now, policy arguments obviously are, this legislation will help us take care of patients better or more cost effectively, and will ultimately save Medicare money. So obviously, we don't want to construct policy arguments that the end goal is to make occupational therapists more money. The end goal is to improve patient care, whether the healthcare reimbursement rates is more incidental, right?
Well, I'll do a great job. They have student loans that they pass.
A little bit. We want to make the more are coming through. I think it's also important. I mean, most staff members will be familiar with, rehabilitation therapy, but there may be other differences between occupational therapy and physical therapy, and that's always useful to talk about that. And then secondly, the larger context of things. I think there's a general consensus that the Medicare program as it stands now is sort of a mess. We've had in the last 6 years, 6 pieces of legislation to block pending cuts to physician and occupational therapy fee schedule cuts, and also 6 interventions to block pending therapy caps. And the reason for those sort of stopgap measures, as I'll call them, is it's very expensive to have a permanent solution. So one of the things that we have been stressing when we've been talking about the therapy caps was the exception process is in itself a big reform, because it only allows warranted care to go forward, and it requires at some threshold, $1,800 now, about